Okay, perfect. We are live. All right. Happy Monday, everyone. I'm used to saying happy Tuesday, so I'm glad I didn't say that. Tonight is very exciting. We're going to have a conversation with two awesome women's/reproductive health practitioners. Tonight, I am joined by our usual Dr. Sophia Yen, CEO and co-founder of Pandia Health. She's also an adolescent medicine doctor in California. And then we are also joined by the lovely nurse Barb. She is a nurse practitioner specializing in women's reproductive health. And you can also check out her blog and website. It's just Nurse Barb at nursebarb.com. Amazing. Yep. Perfect. And we'll write that in the comments. So I'm really excited for tonight. We have a lot of fun topics to cover. I wrote in the title reproductive health, which could really encompass a lot of things, but we're going to break it down. But with that said, before we get started, I wanted to just have you each give a little brief introduction of kind of where you're at, specifically with women's health and why you got inspired to start in this field. So Nurse Barb, I'm going to put you on the spot since you're a guest of honor. If you want to go first, that would be great.
Well, I think number one is I'm a huge fan of Pandia Health. And I would have to say, I don't know if I'm the president of Dr. Yen's fan club, but I love that it's women owned. I love that it's so easy for my patients to access their birth control. And I love your little gift bags that you send along. So it's been really nice. But I'm Barb Dean. I'm a women's health nurse practitioner. I'm Nurse Barb on NBC's California Live. And I talk about everything having to do with women's health at every age and stage. But I'm delighted because I see a lot of women who want to talk about contraception and a lot of the non-contraceptive benefits. And I don't want to steal any thunder, but there's a lot of hashtags I think we're going to talk about tonight.
Definitely. Awesome. Dr. Yen, go for it.
Yeah, I think I've always been interested in reproductive health as a future physician when I was a teenager. And so as a pre-med, I volunteered at Planned Parenthood giving pregnancy test results. And I remember I was 15 and a 13-year-old came in and she got a positive pregnancy test. And I was like, whoa, this is totally going to change the rest of her life, depending, which way she chooses. And she chose to continue the pregnancy. And at Planned Parenthood, it's all about choices. You choose whatever is according to you and your body. I would have chosen differently. And to see how our paths diverged. I was 15, pre-med, went on to MIT, UCSF, Children's Oakland, back to UCSF, Berkeley for an MPH, and then finally Stanford to become a clinical associate professor. And she was about to embark on motherhood, a single motherhood. And would she finish college? Would she finish high school? Would her partner leave her? Would her partner stay? And if she only had access to comprehensive sex ed and birth control, I think that situation could have been prevented. And every time there's an unplanned teenage pregnancy, somebody with a uterus suffers. And so that is the beginning of my passion for reproductive rights, both from my personal, but also seeing someone else and the effects that it could have. And started Pandia Health because was doing a talk to a bunch of physicians. Why don't those women take their birth control? What is their problem? And the number one reason was didn't have it in their hand. Didn't have time to run to the pharmacy every single month for 20, 30 years of our lives in a proscribed 7 days ahead of time. If you go 8 or 9 days ahead of time, insurance isn't going to cover it. And so the whole point of Pandia Health is set it and forget it. Let us worry so you don't have to. We'll do the 7 days ahead, or we'll try to push the insurance and do 10 days ahead. But for us to worry, not for you to worry. And we call that hashtag Pandia Peace of Mind.
Absolutely. Yeah. And I know we posted something today about having better things to do, hashtag better things to do, than going to the pharmacy to pick up your birth control. And then also I was thinking about it every time I would go before to pick up my birth control, I would also go and buy something I didn't actually need. So, avoiding that as well. Just another perk. And I use Pandia myself to get my birth control delivered. It's always on time. You always get cute little goodies. We made a little poll to see what goodies you want in your next basket. So we'll see. I'm curious what people have to say. Yeah. So thank you both for that awesome introduction. We're going to move into a couple different topics, starting out just a very basic question, and we can start with Dr. Yan if you'd like. We'll be talking about adolescence versus kind of like adulthood. So how would you define adolescence?
So I think that I do belong to the Society of Adolescent Health and Medicine, and some would say that it starts at 8 and goes up to 25, because you can begin with a little bit of puberty 8, but periods would start at 12. But first you get breast buds for those of us with uterine breasts, and those without uterine breasts starts with I think oh gosh, I haven't done this in a while. It's I think it's testicular enlargement. Yeah. Is that right? Nurse Barb, I see you nodding.
So I'm nodding. I'm thinking about this like it's a little bit of hair growth, right?
Yes.
Adolescence, little underarm hair, little, oh my God, what's that?
Hair.
Oh my God, what's that pubic hair about? And then a growth spurt,
yes.
Right?
Yes.
But I like how you describe it. I also talk about adolescence as there's two main tasks. Who am I? Like trying on different roles, and then finding your tribe and trying to fit in. So you've got all these huge body changes going on, and then you have all these emotional changes, right?
So many changes. You're trying, psychologically, as you said, to decide what you want to do, what you want to be when you grow up. That's like the number one pediatrician question that we ask is, what do you want to be when you grow up? And then in adolescent medicine, we'll let you be like, I don't know, until like 13, 14. But by like 15 and on, you should have an idea. And certainly you can say, I don't know, but I'm like, well, do you like science? Do you like history? Do you like art? Do you like programming? Do you like debate? You got to make money. And so you got to support yourself. You're going to leave the nest. You have to have a means to the ends or something. I'm not good with colloquialisms, but I ask people, what are your goals after college? And that's kind of like my cognitive think question. And they're like, oh, I want to graduate college. And I was like, no, you go to college so you can get skills, so you can make money. So what are you going to do? You just can't just go to college. That can't be the end. The end is, what do you do with that? What is the point of going to college? And so, yes, and that is one. And then, of course, your body is changing. And I see people fight that change. I see people resent that change. I personally did not enjoy and still don't enjoy bleeding monthly, because it would come with zits and emotional swings and weight changes. And 30% of those people who have periods have GI side effects, so either diarrhea or constipation. And I think it's just something we need to put out there, because like we all think we're all alone, or we're little freaks, and then we find out, oh, 1 out of 3 people, it's not just me. Thank goodness.
Yeah, no, definitely. It's a lot going through it when you're young, and it's hard, especially when you don't necessarily know who to go to. And that's why it's really great that we have resources like Pandia Health, like Nurse Barb and her website out there, because there are unfortunately a lot of other resources that you can find that aren't necessarily the most positive, and just shed it, puberty and all of that in such a scary light. And it definitely is scary, but at the same time, it's also very exciting. You're becoming a new same person, but a different slightly version of yourself. And there's a lot you can do with that. There's like a lot of freedom there, which is pretty cool. So that kind of brings us into our next question, which you touched upon a little bit. As you approach adolescence and then moving from adolescence to like young adulthood, periods are something that come up. So Nurse Barb, we can start with you. What are some tips you have for younger girls or people with uterus who are like nervous about getting their period, maybe just starting their period? What are some tips you have for them?
I love this question, because one of the other things that happens is there's a lot of vaginal discharge, right? And that's one of the most Googled terms. Like, what does this discharge mean? Like this white stuff, this yellow stuff. What if it's about this clear, thin, looks like uncooked egg white? And then I had a patient the other day call me and say, wait a minute, like there's like brown, it looks like coffee grounds, right? What is that? And then of course the period. And if it's, as Dr. Yan said, like there's a lot of nausea, vomiting, diarrhea. There's a lot of people with so many cramps they can't even go to school. So I think that the number one thing to do is, do you have a trusted adult in your life That's important to be able to say, wait a minute, I'm normal, and to have somebody just validate, like, this can suck, right? This is not always, oh, it's not my friend. When people called it that, like, it's not my friend. I don't like this. But for some of us, we just want to know, look, some of these hormonal changes that are happening, they're not forever. That's one of the most important points, is you may not always be experiencing this. And I know we might get to this in a minute, but when you're talking to a healthcare provider, what I do with my patients is, number one, I say, you probably don't need an exam. And they're like, oh, thank goodness, right? They can just relax, because as Dr. Yen will tell you, if you need to access contraception for preventing pregnancy, or for the migraines, the heavy, painful periods for what we call non-contraceptive benefits, you probably don't need an exam. And that takes a lot of the pressure off. And one of the things I start with is I have an illustration, and I'm like, this is your menstrual cycle. Look at this hormonal roller coaster. No wonder you feel like this. And people are like, oh, because as women, we can't peek inside. We can't go, wait a second, what's going on in there? We don't know. And so when we talk about it and people are trying to visualize it, that's impossible, right, Dr. Yan? I've got to show them some illustrations and go, this is the hormonal roller coaster that you're on. And people are like, oh, that is why I'm bloated, or I don't quite feel like myself, or that's why I might be more interested in having sex at the the middle of my cycle.
Definitely. Dr. Yen, did you want to add anything to that?
Yeah, no, I love having a trusted adult, hopefully somebody who understands the physiology, because sometimes parents don't know, they didn't get that education, or they don't have mandated sexuality education, or they were sick that day or something like that. So definitely a trusted adult, a health person, a nurse practitioner, a physician, whoever is your primary care provider is also an option. I trust bedsider.org in general for like birth control stuff, but for periods, American Academy of Pediatrics, of course. And there are YouTube videos on menstruation from purely the, hormonal physiological view. The number one thing that I see on YouTube when I do videos is I got my period and then it's been like irregular and strange. And the first question is, how old are you? And when was your first period? Because within the first 2 years of your first period, you are allowed to be whack and weird because it's trying to learn. And some women, amazingly, immediately go to every month. But for up to 2 years after that first period, it can be totally strange and whack. And so we don't address that in our videos because our videos are targeted more for 18 and above, or, 15 and above, where it should be regular by then, because it should have been 2 years after your first period. Most average in the United States is 12 or 12 and a half years old to get your first period. The other rule of thumb is 100 pounds or 22% body fat. If you get it before then you may want to see a physician and discuss that. And then, as Nurse Barb mentioned, there's also this physiologic leukeria is what we call it. And what it is white discharge that comes out of your vagina. Normally, if you had white discharge that was nasty, itchy, or something, we'd be like, sexually transmitted disease. But these are young women who've never had any heterosexual or homosexual and anything. It's their body preparing to have a period. And it's like, I'm just going to have white glop come out for like 6 months. And my youngest is going through that right now. And she calls it the splat. I have splat today. So,
wow, that's great that you talk about it. I love that you talk about it.
Well, because it's on her underwear and she wants to know. Mm-hmm. So also it can ruin you if you have colored underwear. Luckily, I'm all about white underwear because it's easy to bleach and clean. Mm-hmm. And so, but if you had like red underwear, black, or any other thing other than white, the white blood cells can actually open up and like stain your underwear and, change up the color and whatnot. So yeah, number one, it can be totally weird for the first 2 years, and that your hormones are going up, your hormones are going down, your hormones are going up, they're going down. And the same thing with the lining of your uterus. It's the hormones go up and the lining builds rich, full of blood, waiting for a potential baby. And then it's like, oh, no embryo. Okay. And then it bleeds. And then it's up and down and up and down. every single month from age 12 and a half plus 2 years, because it's irregular, all the way until like 50 or 55. And part of, what we want to share is hashtag periods optional. Go check out my TEDx talk. But just know that in the old days, and when a more natural form, we would have 100 periods in our lives. And now we're having 350 to 400 periods. And every time you build that lining, it could mutate and turn into endometrial cancer. Every time you pop out an egg, it could mutate. We don't know if it's the popping or the healing into ovarian cancer. And so we don't need to bleed as often as we currently do. And I had that realization trying to get pregnant because I kept building and then be like, oh, no embryo, and then bleed and be like, oh, the only reason we bleed is because we didn't catch an embryo. The whole rest of the time, I don't know why I was doing this up and down and up and down and up and down from age 14 to 35, which was my first child, right? And then on the back end, from 38 until 50. So
yeah, it's a rough time. That's a lot of years. And that's what's really nice about birth control is that you can take charge. You like really have a lot of power in that sense, that irregularity can really go away. I mean, it might be for the first couple months on your birth control. Don't be alarmed if that's the case. But after a while, yeah, you can really start to create that pattern for yourself, whether it's always skipping your placebo pills or knowing at least, okay, this is the week I have placebo pills. So I will probably bleed on like the third day. Let me have pads that day. But either way, it's great to be in charge of that. And I'm glad that's something that we're talking about because so many people don't know that. They're like, what? You can skip your period? Yes, safely. If you're not getting it, but you're not on birth control, talk to your doctor. That could mean you're really stressed out, you've lost weight, you've gained weight. But again, with birth control, yes. We got a little question asking if it was normal to get discharge before you started your period.
Yeah, I think Dr. Yen said that. In fact, that's a sign that it's going to happen. And it's, your body makes this great hormone. It's called estrogen, and it gives us our curves, right? Soft skin, higher pitched voice. And that white discharge that you talked about, that's estrogen dominant discharge. And then once you start cycling, typically women will have a little bit of white, then a little bit of clear thin, and then a little bit of yellow, unless they're on contraceptive, like oral contraceptives like the pill or like one of the rings. And I like what you're talking about with periods optional. I'm always having to reassure women that it's okay to skip. In fact, there are times when I'm prescribing the pill and I'm saying, don't take the placebos, don't take the sugar pills. If you have a migraine headache, if you're having mood changes, right? If there's other issues like super heavy periods where you can't go to school and you're throwing up, I have patients, I know you do too, Dr. Yen, who get anemic because they're bleeding so heavily. And there's, as you said, there's no reason why you have to have a period every single month.
Exactly. Yeah. And it's crazy that I feel like it's almost like people want you to have a period because like no one ever talks about that. And I remember in a class that I had in human sexuality in college, someone was like, well, I don't want to mess up my fertility or my just like regular flow with my uterus. But that's actually that isn't something that can happen. It's not related to infertility. And in fact, it can actually help you better plan if you're trying to get pregnant and things like that. So just something to keep in mind. So kind of going off of that, our next question is, when do your hormones start to kind of stabilize? And honestly, a follow-up question is, do they stabilize at all? Will I ever start to feel kind of, calm? Will the bleeds start to get more normal? Or is it just something I have to live with every month being like, oh, what am I going to do now? Anything you'd like to add to that? And again, Nurse Barb, we can start with you. I know this is your expertise.
Oh, I think both of us, right? So I think that for everyone's different. One size never fits all, right? And that's why I think when you're talking to a provider, you want to talk to someone who really knows a lot about different kinds of hormones and different kinds of contraceptive options so that they can tailor it to what you're going through, because everyone is different, right, Dr. Yen? And I think that, some people stabilize right away. I guess it's like the bell curve. right? Some people are over here and they're like, 28 days. But that's not typical, right? Very few women actually have a cycle that's every 28 days. And and we do cycle with our friends, so if you're living in a dorm situation, you might be cycling with your friends. But I have a lot of patients, and I think it's about 1 in 8 with polycystic ovarian syndrome, and their hormones are all over the map. And we use contraception like birth control pills to reduce their risk, as Dr. Yen said, of endometrial cancer. And we try to use the pill to reduce their risk of acne and excessive hair growth because it really works well for that. So hopefully, after 2 years, as Dr. Yen said, most people will stabilize, but not everyone does. And that's why you want to see a provider who can individualize your treatment.
Yes, absolutely. Always talk to your doctor. We actually have an article about that on our website about how to comfortably.
Or your nurse practitioner, right?
Your provider.
Your provider.
Yes, exactly. Your provider, just about how to talk to them about those uncomfortable topics, because to be honest, they've probably heard it all. And if they act like they haven't heard it all, then either A, that's just kind of their personality, or B, you can always go to someone else. I did that recently, and I found someone who was a lot more comfortable with me, and it just made the whole experience a lot more pleasant. I found myself opening up more about things that my past providers probably should have known, and so it's kind of just a trial and error, but you'll find the right fit. Kind of same with birth control, which we'll talk about later. Dr. Yen, did you have anything to add about that? How to kind of know when you're stabling out, or what to do if you feel like you're just always up and down with the hormones?
Yeah. So I would say that, hopefully you'll hit your stride within 2 years after your first period, though there's every person is different. And actually the people that start later have a longer period of irregularity. And I think it's because something was different about them that they started at age 13 or 14. And therefore, then it takes longer for them to, quote, normalize or get regular. And exactly as Nurse Barb said, your roommates have an effect on you. And I just love my MIT dorm room in retrospect. It is perfect for my company. I talk about it all the time. There were 3 women in the room, and one was every 28 days. And then there was every 35 day. And then there was the PCOS person every 90 days. And the 28-day person's hormones were so strong. She's crazy fertile. She drove the 2 of us to 28 days. And I'm like, I am a 35-day person. Why is it 28 days? And then the 90-day woman who was like about to get worked up for PCOS, because that's what she had, got drawn to the 28 days. So even if you hit your regular, I had been at my regular without being in this dorm room when I was living alone in my house with 2 brothers. So no other woman to moon cycle with me at home. But now I came to this MIT dorm where there's 3 people sleeping in a very close quarter for at least 8 or 12 hours a day. Then I cycled to her. And know that, if you're not on hormones, then you are up every month. Embryo down, and then up and then down and up and down and up and down. You will be that, but hopefully your body will find its own, rhythm to that. But with our technology, birth control, not for birth control necessarily, but for hormonal treatment, we can choose to just make things smooth, rather than up and down and up and down and up and down, or smooth for 3 weeks and then drop. But I say this drop is optional, and you can choose to do it every month, every 3 months, every 6 months, or never. And I haven't bled for the past 11 years unless I forget to take my medicine or there's some exacerbating factor.
Exactly. Yeah. And it's all really good to know that it's not the end of the world. If you feel like at the beginning of puberty, you're just all over the place. There's a really good show on Netflix called Big Mouth. I reference this a lot, where they just have really good references how the hormones are like a monster kind of invading your body, and then as you grow up it becomes something a lot different, and how there are pros and cons, as you mentioned, Nurse Barb, with estrogen. Like that's what gives us our curves and makes us feel more feminine and beautiful and all that stuff, but at the same time you're like, oh, but it's also making me bleed. So what is this? But no, there's a lot that goes into it, and this kind of brings us to our next question. So someone who wants to go on birth control, they're like, I'm done with my period, I want to help regulate it. or just, to prevent pregnancy. And we'll go into some of that a little bit later. What would be, I'm totally forgetting the question right now. Oh, do they need, I'm like, wait, what was I going to ask? Step one, do you need an exam? I know we briefly mentioned this before. Is that something you need to do in order to get your birth control? Dr. Yen, if you want to go first on this one.
Well, given that Pandia Help is online birth control, we obviously are not physically examining anybody. All you have to do is answer 20 questions, the same that I'd ask you if you came into my office. It's a protocol that's been approved by the state of California for pharmacists to write birth control. So we just added a layer of doctor on top, but it was approved by the California Board of Pharmacy, California Medical Board, and California Academy of Obstetrics, American College of Obstetrics and Gynecology of California. For pharmacists to prescribe. And so as long as you answer these questions and you don't have any red flags, then it's fine not to have a pelvic exam. We do ask for a self-reported blood pressure within the past 365 days to make sure you don't have any high blood pressure, because that is a risk for blood clots. And if we choose an estrogen-containing pill, which most pills have, then you would be at risk of a blood clot. There is a progesterone-only pill option, but our joke in medicine is, what do you call a woman who's on progesterone-only pill? You call her mom or pregnant, because if you take it 3 hours late, you need emergency contraception or backup. There is a new progesterone-only pill, and that one's more forgiving by 24 hours, so that's cool. But the negative on that is crazy expensive. So it's a brand name, and it's like, I don't know, $200 a month versus most birth control pills are $15 per month. Yeah. And free if you have insurance, thanks to the Affordable Care Act, thanks to former President Obama and current President Biden for passing that in the Affordable Care Act.
Very exciting. And then Nurse Barb, if you want to kind of add on to that with, if someone is interested in going on birth control, what is something that they should do? What's kind of like a first step that they should take?
Well, I think that now with telehealth and Pandia Health, I think it's a perfect place to start. Because, if you're trying to be super responsible about your life and your future, and you're thinking, I'm thinking I might want to do this for whatever reason, for contraception or for those non-hormonal reasons, I think this is a really good first step. And one of the things that Dr. Yen always emphasizes is emergency contraception. So those times when people forget, because everybody forgets, I forget, everybody forgets. Right? Unless you're in a routine, we tend to forget. So having that emergency contraception available, knowing how to do it, like, oh my God, what do I do in the middle of the night? Where's a pharmacy that's open 24/7? And I think that one of the things I do whenever I'm prescribing is I also prescribe the emergency contraception and talk about it. In addition to always talking about condoms and prevention of STI or sexually transmitted infection. And, it's important. I had a patient tell me the other day that she was in an open relationship and that she, I'm kind of segueing here. So she's on contraception and she has PCOS. So, but she's in an open relationship and she's had multiple partners in the last month. And her partners have multiple partners, but she was not using condoms, and it did not occur to her that she was at risk for an STI. And I think it's because she has a job and she pays taxes, and she's like, oh, that's for those younger people. No, it's for everybody, right? And so that's one of the other things I like about Pandia Health is that you guys emphasize prevention of STIs. Yes. And you give condom samples, right?
We give out condom samples. We have a deal going on with one condom. If you go to bit.ly, and then you put capital P Pandia and then capital O1, Pandia 1, there's a 40% off a condom deal that comes with their most sensitive condom that comes with lube with each condom. And then there's like a sampler pack of I think 8 different condoms with like glow in the dark, bumps, all sorts of fun things to try, different colors, maybe flavors. And then it also comes with a giant thing of lube as well. And we always say condoms plus some hormonal method if you're using it for, heterosexual relations. And I advocate for the condoms in addition to sexually transmitted infections. Just as a person with a uterus, I don't want to leak semen for 24 hours. And if the other person had to leak my fluids for 24 hours, they definitely make sure that I put on something. So I think we as uterine bearing people suck it up and don't complain. And I'm not saying we should complain, but I'm saying we should like speak up, like all the stuff we suck up, like the diarrhea, constipation, the blood, the embarrassment, the why do I have to hide my tampons? I should be like dancing around. Look, I'm fertile. I'm normal. and I've seen that with, I forget some of the comedians, right? They're like, if dudes bled, they'd be like, I have the biggest tampon. I have the biggest bleed, or whatever. Whereas we're all like, I did it in the purse, put it in my sleeve, blah, blah, blah. True. And so absolutely condoms to prevent sexually transmitted infections. Emphasize that we are not your primary care physician. Please see your primary care physician, and anyone under the age of 26 get tested every year if you're heterosexual for sexually transmitted infections. If you're homosexual, men who have sex with men, obviously, but women who have sex with women or uteri with uteri don't need sexually transmitted infection testing unless either of you have had some hetero at some points. Because once you get herpes, HIV, or HPV, well, the first two, they're your friends for life. HPV will kick 80% of it. And if you get your vaccine, I recommend you all get your vaccine, then you'll prevent 90% of cervical cancer. And if you got the latest one, 90% of external warts. If you got the original HPV-4, then it's only like 70% of genital warts. And so even if you're monogamous, but if your partner had another partner at some point, or you had another partner at some point, and you're like, we're married, we're not going to use condoms ever again. One of you got HPV. It could be the 100th time that you have sex that the HPV comes over, and then you get warts. And you're like, oh my God, you cheated on me. Blah, 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 blah. It's like, no, it just happened that 100th time that your immune system was down, his immune system was down, and the virus came over. But it is also possible he cheated on you. So.
Be careful. Open and honesty. I think that's always important, not only with your doctor, but also in relationships. And it's just, I would want to know if someone had a history of an STI, even if they didn't have it right now. I think I would actually rather them tell me and have them and know that they were treating it than just have them not tell me, because I wouldn't judge. I'd be like, you know what, good for you. It happens, but I'm glad you're getting it treated. And there's a lot of stigma around it. Kind of with everything in puberty and sexual health, but it's important to just be honest with yourself and with your provider and your partner, just for safety on all areas. And that also helps just enjoy, I think, your relationship a lot better when you know what you're getting into. And I think that can make it a lot more fun. So
yeah, and I think if I can add something,
yeah,
a lot of times people don't know, because a lot of these infections are silent. And so one of the things that I recommend is that I have a little script. In fact, I have a video on it. It's like, hey, things are heating up, and it looks like we're probably going to be spending some time together. And I would like to know what else we're sharing besides a good time. So I'm going to get tested, and I'd like you to get tested, and then we'll share our results with each other. And you'd be surprised. Men, if you're in a heterosexual relationship, men are like, hey, she's pretty cool. She's high status. Like, she's not everyday, right, ordinary person. She's somebody I want to be with. If you ask, they typically will do it. And if you ask and they don't, you're like, well, hold on a second.
Yeah.
What's more important? You having fun or me being safe? And so I think it's a kind of a cool thing. And a lot of people in college, like, they do it as a date. They're like, okay, let's go to the health center together, and then we'll share our results. So I think that it's super important, for you to make good choices, make sure it's consensual, make sure you're staying safe, and to have fun. But let's also be honest, that's a hard conversation to have. It's a lot easier to have sex than to talk about sex. So that's why we do what's called universal screenings. And to Dr. Young's point, when women come in every year, we're like, you know what, we just screen everybody. It's just a lot easier, especially for chlamydia, which is, 4 million, I think, plus infections a year, and that's probably underreported. And so then there's no stigma. You don't have to say how many partners you've had. We don't care. We actually, right, Dr. M, we don't care. We're like, as long as you're safe and having fun, it doesn't matter. There's no shaming. Most of us are very sex positive. Like, are you having fun? Are you having orgasm? Yippee, skippy. But let's keep you safe.
Let's be safe. Exactly.
And then just one caveat on that is that, just assume everyone has every sexually transmitted infection under the sun, because when you go to get tested, we don't test you for everything. We usually test you for gonorrhea, chlamydia, and we'll offer you HIV, but we aren't testing for HPV. We aren't testing for HIV, which, as you know, is a killer and there is no cure. We can extend your life now. We've seen people live 40 plus years on the right drugs, but there is no cure. And so even if somebody has a negative HIV test, that tells you 6 weeks ago they didn't have HIV. But if you haven't been with that person 24/7 since 6 weeks ago, then during that time they could have got it and their body just didn't make the antibodies yet.
Right.
And then
I have
herpes,
to adjust something.
Yeah, herpes is only diagnosed generally through a blood test. So if they didn't get blood, they didn't check for herpes. And so the number one sexually transmitted infection is HPV, but now we have a vaccine. But no, the vaccine only covers 9 out of 160 strains of HPV. And then HSV is very common, and you can actually take the mouth HPV now with oral sex, thanks President Clinton, but also in general. You can take this and put it down there, and then you stick that in you, and you just gave yourself herpes down there. And so, again, those tests are done by blood. And if it hasn't been a blood test, they didn't check for HSV1 or HSV2. There is a culture that you can do, but it's oftentimes negative unless it's a fresh lesion. If it's crusted over, it's not going to work. So just because they have a negative STI, I would still use the condom unless you were both virgins and neither had been sexually assaulted to begin with. But anything outside of both virgins, just assume everybody has every sexually transmitted infection. And for HPV, know that there is no commercially available test for HPV in a person with a penis. And that the only time we call it when we see it. So you could have sex with it and then you got warts a week or 2 or 3 weeks later. I'm like, I'm sorry. You bring it in. I'm like, oh, that's the cleanest penis I've ever seen. And you have sex with it. And like a couple weeks later, you got warts. Oh, I'm sorry. I guess it was what it was. And then for those that are playing with those with uteri, when we do a speculum exam, it's like all these walls and all these rugae, and there's no way I can check every nook and cranny to see if there's a little wart or a little HPV in there. If there's a giant one, yeah, I'll find it. But like microscopic, I may not see it, So the pap smear is a proxy for HPV. But it doesn't tell you everything.
Yeah.
And we don't do that until 21. So if you're under 21, there is no HPV testing going down.
Yeah. Get tested. Long story short, very important.
And use a condom.
Planned Parenthood too. Because men and women can go to Planned Parenthood. So if you're like, where do I go? That's always a great place to start. But yeah, so going into the next question, and actually someone kind of made a comment about this, so perfect timing. 2 parts. So is it normal to have acne as an adult? So I guess let's say like 18 plus. And can birth control help regulate your acne? There's Barb, if you want to kick this one off, go for it.
Some women, it's a great question. I'm so glad it came up. Some women have acne throughout their life, and sometimes it gets worse in pregnancy, or it gets worse in their perimenopause, before menopause, like in their late 40s. But here's the thing about birth control pills. When you take an oral birth control pill that has estrogen in it, has to have estrogen, it goes to your liver, and your liver goes, hey, guess what? I'm going to make this cool protein called sex hormone binding globulin, and it binds to the male type androgenic hormones like DHEAS and testosterone, the ones that make oil and the ones that make more hair. So just about every birth control pill works for this. And it takes about 3 months. And sometimes if a woman is doing this, they'll go, oh my God, it got worse the first month. After that first month, it tends to get better by the 2nd or 3rd month. So that's one of the ways that I help my patients control some of their acne. And now a lot of dermatologists are doing the same thing. We also use that with women with PCOS because acne is a big issue for them. And it works very, very well.
Awesome. Yeah. So it is normal, unfortunately. But if you notice that you have acne,
everyone's different, right? Everybody's different. Some people have curly hair, some people have straight hair, some people get more acne. And that nice oily skin, though, they tend not to get as many wrinkles as they get older. So I know it's kind of a trade-off. It's like early on, it's like, oh, I've got all this acne. And then later on, they're like, hey, I have fewer wrinkles than some of my friends.
Mm-hmm. Exactly.
I would say on the acne front, some people want the birth control to fix their acne. And some people's acne is just too strong, that the birth control isn't enough. That the birth control is helpful if you're a person like I was who only got one zit a month, but giant painful zit. I called it the North Star. It would happen here, here, or here. And it was like to add insult to injury. Not only am I bleeding, but I'm looking ugly too. So, but once I smoothed out my hormones with the birth control pill, no longer did the North Star visit me. However, if you're like a lot of people in my family actually have bad, evil skin more on the man side of the family, but their daughters or their family that inherit those kind of genes as well, just have horrible acne. And then they come to us and they're like, can I use a birth control for acne? I was like, well, if there's a hormonal component, sure. And then like, but it didn't fix the acne. And it's like, it probably made it a little better, but yours was so strong that this was not enough. And so at Pandia Health, we're actually going to launch acne within the next month or so. And the first line treatment for acne is tretinoin. So it's a cream that you put on your face. There is an over-the-counter one right now, adapalene. And we'll also talk about topical antibiotics and oral antibiotics for the acne. So sometimes it is enough just to use birth control for acne. But sometimes if it's like teenager, new, severe acne, then maybe not. Yeah. And generally, if you have new acne that you didn't have before and you're like older, you may have polycystic ovarian syndrome. 1 in 10 women will get that in their lifetime. And as you gain more weight, there's a greater risk for that, though 10% of PCOS is skinny. Or as Nurse Barb mentioned as well, if you're pregnant, that might cause some acne. And certainly there are random brain tumors or adrenal tumors that can cause acne where there was no acne before. So if you had no acne and then all of a sudden at like 21 or 25, it pops up, I would, maybe look into just check your hormones, check PCOS. But if you've always had acne, yes, I think like 25% will continue to have acne. My husband certainly is one of those.
I'm really glad to hear you say that you're going to start the medications, because so many people get intimidated by the idea of seeing a dermatologist, and it can be super expensive. And so people don't have access. And when I think about some of my patients who really have very limited income, but they're really bothered by this, of course they are, right? Our appearance is so important. I love that you're doing this because it sounds like it's a very comprehensive approach.
Yeah, and 90% of acne can be handled by a primary care physician, and it really comes from my background in adolescent medicine, which is sex, drugs, rock and roll, a little acne, and a little sports medicine. And so I've always been into the sex, preventing unplanned pregnancy, sex positivity, preventing sexually transmitted infections. And then now we're doing acne, which I've always loved because as a Asian American, there's a lot of Asians with really bad skin. And so I'm like, oh, I could totally fix that. Just like I would hand out cards and be like, go see your doctor, ask them about this drug, or come see me at Stanford Teen Clinic, because I give you a pill and we could take care of that, you don't have to suffer. And I think that works with periods. And that also works with acne. Just because it runs in the family doesn't mean you have to suck it up and suffer. We now have technology to, take that away. And people are like, well, that's not natural. And when people say that's not natural, I say that 1, it's not natural to have as many periods as we have now. But 2, if we were to go natural, I would be blind and stuck with allergies, and I'd be useless in this world because my eyes are horrible and my allergies are super bad. So I probably wouldn't be a doctor if I had to go natural.
Exactly. Yeah. And like same thing with athletics and all of that. Like if you're bleeding all the time, I wouldn't have done dance for as long as I did with pink tights. And so
tennis with the white skirts.
Oh yeah. Oh wow. Yeah, exactly. There's just
or
so
gymnastics.
Well, I have a lot of triathletes. I have women who are volleyball players. You know, they can't. You know, you've seen some of those uniforms that they have. Like they're basically no uniform, and so and even younger girls who are on the swim team, water polo.
Yes.
You know, they don't need a period every month. It's not necessary. So I think it's so nice that there's lots of options. And what I try to remind my patients of is when we're using birth control pills, we're using estrogen and progesterone. Those are hormones your body already makes.
Right.
So it's not like you're taking a chemical. You're taking hormone, and your body, guess what? Your body actually makes hormones every month. And I think that's really surprising for a lot of women. It's like, oh yeah, I forgot that I had those hormones already.
Yeah, it'd be very strange to have an allergy to the birth control pill, its active ingredients. And when people have an allergy, it's not the estrogen or progesterone.
Right.
It's the dye, the coloring, and other things that they put in that particular mix, because these are hormones that are in your body. It's like being allergic to water, which, you just can't be. Otherwise, you can't exist on this earth.
Exactly. Yeah, no, this is all really great. And it actually brings a perfect segue into our final topic, which is birth control and its benefits. So I feel like so often we hear about the stigma with birth control, and we hear people saying, you don't need to be on birth control. It's going to make your hormones all crazy. It's not going to help with anything. And there's also a stigma of like, oh, if you're on birth control, it means you're just having sex with a lot of people. And it might be true. And if that is true, more power to you. But there are so many other benefits. So I just kind of wanted to chat a little bit about that between emotional, physical, cognitive, all of those different things. So Dr. Yan, if you wanted to kick this one off, that would be great.
Yeah, I have a TEDx talk, hashtag periods optional. So if you go to pandiahealth.com/periods optional, I'll drop it in the comments. At the bottom is my TEDx talk on the science and safety of fewer periods or no periods. And one of the slides, I'm not sure if I included in the TEDx talk, but it's a talk when I give to providers, nurse practitioners, physicians, the medical benefits of having fewer periods or no periods, and the medical benefits of not having any periods, which is you just maintain a stable hormonal level. This is good for acne. This is good for asthma. This is good for depression. This is good for anxiety. This is good for diabetes. This is good for seizure disorder. And you can imagine as a teenager, your hormones up and down, and then blood randomly hitting you 1 day out of 4, and then acne. We can take care of the up and down. We can take care of the acne, and we can take care of the random blood 1 week out of 4. The number one cause of anemia in a menstruating woman, as Nurse Barb said before, is menstruation. That's a question we ask all medical students. We like to ask them random questions to test their knowledge. And what's the number one cause of anemia in a menstruating woman? Menstruation. And then in my talk, what's the number one cause of missed school and work under the age of 25? Not just in some third world country, but here in the United States of America. Bad, evil periods. Because I've been in communities where young women will miss 2 days of school a month. And you're like, 2 days, that's nothing. That's 10% of her education. And so if you envision her education, I like to see it as a wall. And I punch 10%, punch 10%, punch 10%, punch 10%. And then I put pressure, it's going to collapse. Whereas the dude next to her without the uterus has none of it. His wall is solid and strong. And you put pressure on it and it's not going to mess up. Not to say that women are inferior. I like the poster that says, I can do everything you do. Bleeding,
Exactly.
But do I have to do it bleeding? Would I prefer not to do it bleeding? Yeah, I would prefer not to do it bleeding. And so then it decreases your chance of ovarian, endometrial, and then colorectal cancer. And the colorectal cancer, the way I think of it, I have to bring my prop. You are like bleeding every month. And then your colorectum, the intestine's right around it. And so as the hormones go up and down and blood, your colon's like, oh, I'm sad for you. I'm going to run faster. And then you get diarrhea, or I'm going to slow down, and then you get constipation. And so if you don't go up and down and up and down and up and down every month, you don't have the risk of cancer. You don't have the colon doing its thing. You don't lose blood. They've actually shown that those people with more hemoglobin have better mental performance on like mathematics and IQ. And so if women weren't being bloodlet 1 week out of 4, we might be able to do a little more math, a little more whatever. And we're already amazing, but we could be even more.
Absolutely. Yeah. And there's Barb, if you want to piggyback off of that, talking about more of the benefits, that would be great.
Wow, that was amazing. So I just think about some of my patients who come in, and like some of them they'll say like, I'm super irritable, and I'm snapping at everybody. I'm crying all the time. I really can't function. And, we do a good history, right? We really dive into this, and we find that, gosh, right before their periods, this is a really critical time, and it changes their personality. It changes how they live in the world. It changes whether they have joyful experiences, right? And I use the birth control pill to help, as Dr. Yen said, take those hormonal roller coasters and level it out. Then I also have patients who have terrible menstrual migraines, and that's a real thing. And it's not from the drop in the hormones, it's the change, and everybody's different. So some people, if you change the hormonal levels, they get a migraine. And to your point, right, so many times they cannot work, they cannot go to school. And so being on periods optional, being on a continuous method throughout the month can really help impact somebody's quality of life. And it cannot be overstated, right? Because as you said, we can do everything, and we do it bleeding, right? Every month, slightly anemic. It's just that, and the other thing is, I have a lot of perimenopausal women who are in their late 40s. They're still at risk for an unplanned pregnancy, and contraception is important, but also 50%, half will have irregular bleeding. Half of women in their late 40s, early 50s have irregular bleeding. And when they say, yeah, I want something natural, and I say, yeah, the hormones are natural, but guess what? It also reduces your risk of ovarian cancer, because at that age, right, Dr. Yen, that's what they're concerned about, is the cancer risks. Yes. So I think that, for me, we both have taken a vow to first do no harm. And our job is to not do harm to anyone, but to say, here's a menu of options. Here's the scientific reasons behind it. And then you can make a choice, but let's make sure you understand that you actually have choices. Because so many times people, they dismiss it. They can't do anything. Hey, we can do a lot. We can really improve your life.
Mm-hmm. Yeah, between the 40 different pills alone, and then is it 8 or 9 different progesterones?
Yes, 8 or 9 different progesterones.
Yeah, and then there's the IUD, the pill or the ring,
implants,
the implant. There's so many different options, and so your first pick, maybe it will be great, and that's awesome. But if it's not, that's also totally fine. And to reiterate the point of communicating openly with your doctor and saying, hey, you know what? I don't know if this feels so good for me. That's okay. It happens, and you can always try something else. Of course, during that downtime when you are not on an active hormone, of course, make sure you're using another form of protection, all of that. Just a side note, as we mentioned before. Yeah. But in general,
I just say something quickly? Yeah. I know we're talking about the pill, but I am an IUD queen. I put in between 1 and 4 IUDs a day.
Amazing.
I love that.
Right? And you know what I do, Dr. Yen? I have a pre-visit. If they've never seen me, I want to look at that cervical os and see if it's closed and tight and stenotic. And if it is, I use a medication to help open it up. And I also do a paracervical block on everybody, because I'm all about no pain. And people are like, hey, gee, this is no big deal. Gosh, my friends told me it was horrible, but I didn't even know. So please, if you're watching this, find a provider who's going to take good care of you, who's going to do a pre-visit, and think about making this as easy as possible for you.
Yeah.
Absolutely.
No, it's great to hear that Nurse Barb, and I would only expect of Nurse Barb to adhere to the latest guidelines, which suggest a pericervical block. But if your doctor or provider is not up to date on the latest and greatest, and that's why at Pandia Health, being the only doctor-led and specifically academic doctor-led, we keep up on the latest and greatest. And the latest and greatest is if you're going to get an IUD, ask for a cervical block, but you shouldn't have to ask. They should know. But if your doctor's been out in the boondocks for 20, 40 years and doesn't have a medical student, resident, or fellow going, hey, Dr. Yen, why are you doing it this way? The latest paper says this, or that you're not the one doing the research or the publications on emergency contraception, you don't know that if your BMI is 26 or greater, Plan B and its generics is as good as water, aka useless, and therefore everybody should be prescribing Ella. And that if your BMI is 35 or greater, then the IUD is your only option. And the new thing there is you can use the hormonal IUD, which I love. The copper IUD, a lot of people after they get it don't seem to realize. I was like, did your person not counsel you on the side effects? But I think maybe you just didn't hear it, or you're like, it's not going to happen to me. More blood, more cramps. So if you're a person who has light periods, doesn't feel a thing, copper IUD. If you're a person who doesn't feel any of your periods, copper IUD. But if you bleed like stink or you feel every single cramp, maybe not the copper IUD. And as I've said, as long as I'm CEO and I've taken the Hippocratic Oath, unlike any other CEO in the birth control field, we will always tell you what's best for your health, even if it doesn't benefit our bottom line. So if you ask me what's the best birth control out there, IUD, hormone, or implants. And if you're not ready for that, then, we can help you with the pill patch ring. There's also the shots. But we can't prescribe that at Pandia Health. We can only do the pill patch ring. And for delivery, we're right now doing the pill, but we can absolutely write you for the patch and the ring, and you can pick it up locally or have it sent by another method.
Yeah, Dr. Yem will tell you. She told me I should change my birth control, and I did, and it worked out. But yeah, even if it's something that won't necessarily benefit them directly, specifically at Pandia Health, and I'm sure same goes for you, Nurse Barb. If you think it's going to help the patient, then 100%. And I totally appreciate that, as I'm sure all of your patients do. So just to kind of wrap up in our last 2 minutes, I wanted to ask if you both just kind of have one final word of wisdom about really anything related to any of the topics we talked about tonight. I know there was a lot that we covered between periods optional, hormones and puberty, how to access birth control, pap smears. What else did we talk about? STIs, all of the stuff under the sun. If you could just, wrap it up in a little bit, that would be awesome. Just final words of wisdom. And if you also want to mention your social media again, that would be awesome. Nurse Barb, if you wanted to go first.
Sure. Thank you so much. What a pleasure this has been. So you can find me on social media at Nurse Barb Dean. It's DEHN. And I would just say, be your best advocate, get the information you need to make the best choices for your health. And you can do that through places like Pandia Health, WebMD, nursebarb.com. And the other thing is, be as kind to yourself as you are to everyone else.
Very important. I love that. And Dr. Yen, any closing words from you?
I think that, at Pandia Health, we're here to make women's lives better. And we're really proud that we are the only women-founded, women-led, doctor-led, academic doctor-led company in the birth control delivery space. And we hope that consumers will realize not all companies are made the same. And that, the goal is not to get the cheapest possible care, because you don't want to skimp on your health. You want expert care by expert providers, evidence-based care, and people with ethics, people that have taken the Hippocratic Oath, people that won't push things that may not be in your best interest. So we have an article called Good versus Bad Telemedicine. I hope you'll all Google Pandia Health, Good versus Bad Telemedicine, and share it on all your social media. I hope you'll follow us on YouTube, Instagram, TikTok, Twitter, Facebook, podcasts, and check out our frequently asked questions. I've taken all the questions that I've ever answered on any platform and put them all on our platform so we get credit for it on birth control, polycystic ovarian syndrome. We have a great article on polycystic ovarian syndrome. And we have 260,000 views on some of our YouTube videos. It's my first time on birth control. Here's Dr. Yen's tips. So we know the questions that you ask. And we love having these times with amazing people like Nurse Barb to, learn from their expertise and to share our expertise.
Mm-hmm. Yeah, this was so great. Thank you so much for hosting this event. I was honored to be a part of it. I'm definitely going to be sharing this on my own social media. I think a lot of my friends could benefit. And thank you to those of you who wrote us questions and comments. We always appreciate that. Again, feel free to check us out on all of our social media, Pandia Health and Nurse Barb. And other than that, thank you all so much for watching. It was great leading this event. And that's pretty much it. Take care of yourselves and be safe. And as Nurse Barb said, treat yourself as if you would treat a good friend or family member. I think that's like, I would say, the most important way. It kind of sums all of this up. So yeah, thank you all so much. Have a great rest of your evening. Yes. Oh, thank you. Yeah. Yes. And we will hopefully see you all soon. We have another live tomorrow. And starting next week, we'll kind of be back on our regular Tuesday situation and hopefully some more collabs soon. All right. Have a great night, everyone. Thank you so much for coming.